With our lumbar cases, we always perform the basic functional examination first. In some cases, we're going to want to perform a lumbar local examination. We're going to perform this examination on those cases where the basic functional examination did not give us the information we were looking for, such as a primary disc-related disorder or sacroiliac disorder. We may also use a local examination on those cases where we found a lumbar primary disc-related disorder or sacroiliac disorder, treated the patient, they got better, but they didn't get well, and we need to go find local problems in the lumbar spine that we need to address further. The local examination is comprised of two major parts. We have tests for provocation, both active and passive, and we have tests for testing mobility. For those tests where we test for mobility, in some tests, we're going to look for hypermobilities or too much segmental motion. In other tests, we're going to detect a hypomobility, where a particular segment moves less than its neighboring segments. Let's first start with the local examination provocation test in sitting. We'll sit our patient on the corner of the table. We'll position the table high enough where we're not having to stoop over as the clinician in testing the patient. But in doing so, we also want the patient with his or her hips at 70 degrees of flexion. If we put them in too much flexion, it'll cause the lumbar kyphosis, and we want to avoid that. So for me, I've positioned my patient's table high enough for me to perform the test, and to keep her hips at 70, I've put her feet up on a small bolster. Now we're going to perform a series of uniplanar and three-dimensional tests. For the uniplanar tests, we're going to ask the patient first to put her arms by her side. I'm going to place my hand on her sacrum, and now I ask her to flex her head forward, and now flex at the shoulders, forward flexing down, and maintaining a vertical sacrum. Keep flexing forward until I tell you to stop. And stop. As soon as I feel the sacrum moving forward, I ask the patient to stop. I look at quantity, how far did she go? Quality, is it a nice smooth curve? And did it provoke the patient's symptoms? Then I ask her to come back up. Now I'm going to ask her to place her arms across her chest, and we're going to perform an extension movement, an active extension. For this movement, I'm going to ask her to extend in such a way where it's as though there's a string attached to her sternum, lifting her chest up to the ceiling. I can guide her elbows to get her to do that test. So I ask her to extend as far as she can go until I feel her sacrum begin to recline, and I say stop. Again, quantity, quality, and provocation. Back down again. We ask for this type of extension so they don't lean back on the table and actually flex. Then we're going to do active side bending. We're going to ask her to drop this shoulder towards her left hip, her left shoulder towards the left hip, avoiding rotation. Here I have my hand on her sacrum. I look at quantity, how far she goes, quality of the curve, and does it provoke her symptoms. I ask her to stop when I begin to feel her right ischial tuberosity start to tip off the table. She comes back up, and now we ask her to side bend to the right. She drops her right shoulder towards her right hip and stop. Again, quantity, quality, provocation. Those are our uniplanar tests. Now we're going to do three-dimensional testing in both extension and flexion, incorporating first side bending, then rotation to give a 3D motion in the lumbar spine. To do this, I'll first do it actively, and I'll start out in extension. I can do this guiding the patient with my hands to ensure the appropriate motion. We're going to first ask her to extend in the same fashion as she did before. She'll extend up until she gets to the end, and at that position, then I'm going to guide her into side bending to her right. Good. And then rotate to her left. It's important that she stays extended for this test. In this test, we're simply going to ask the patient to grade her pain. It is a provocation test. Then I'm going to ask her to once again extend. Good. And then this time I'm going to ask her to side bend to the left and rotate to the left, maintaining extension through the entire movement. She comes back up. I'm going to change sides so I can guide her movement once again. Now she's going to extend. She's now going to side bend to her left and then rotate to her right, making sure we maintain extension. Back up again. And finally, she extends. Then she side bends to the right and follows it with rotation to the right. The rotation allowed because the side bending first allowed her to rotate. After completing the extension provocation test, the active extension provocation test, we're now going to do active flexion tests. For the flexion test, we're going to ask her to first flex, add side bending, then rotation in a similar fashion. In this case, we want to make sure that her sacrum stays vertical. So I'm going to place my arm gently around her just to guide the flexion. We're now going to flex down, flex further, further, further until I tell you to stop. Now stop. After we get there, now I'm going to ask her to side bend towards me, to her left, and then rotate towards me. Good. And then back up again. Once again, purely looking for provocation. Then we ask her to flex again. This time, I'm going to side bend her away from me and then rotate towards me. Good. I'll change sides so I can effectively guide her. Once again, I'm going to ask her to flex down. I'll place my hand on the sacrum to make sure she's flexing only far enough. So let's flex down. Further, 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 stop. And then I'm going to side bend her towards me and then rotate her towards me. And when you do this, you want to make sure that the ischial tuberosities don't come off the table. Then back up again. Finally, we get her to flex down. Good. We'll side bend her away from me and then rotate her towards me. Good. And then back up. Excellent. Now there's going to be those occasions where you won't get the information from the patient that you're looking for with the active test. What is the information we're looking for? We're going to compare the provocation of the patient's symptoms between the uniplanar tests and the 3D tests. If the patient's more painful in the uniplanar tests and either the symptoms get better, don't change with the 3D test, then we're going to be suspicious of some type of disc problem, including internal disc disruption. On the other hand, if 3D testing is more painful, we're more suspicious of something going on with the zygapophyseal joint. If we don't get the information we're looking for, then we're going to do the same 3D tests and uniplanar tests passively. So let's start with the passive uniplanar tests. We'll start out with passive extension. For passive extension, I'll ask the patient to cross her arms. I'll take my hand and I'll stabilize her on her sacrum. I'm going to place my mobilizing arm under her rib cage, and I'm going to make sure when I grab her that I don't side bend her. I want to keep her in the sagittal plane. Then, to begin the extension, I'm going to allow her to lean forward a little bit at the hip joints, and in so doing, I'm able to come up into extension, keeping her shoulders over her hips. My stabilization arm is perpendicular to her sacrum so that I can provide good stability. Here, it's perpendicular, not like this, but like this. Okay, once again, we prevent side bending. We let her come up into extension as though a string is lifting her sternum to the ceiling, and then I can take her back into extension here. I might elect to add a slight bit of overpressure at the end if I'm not able to provoke her with a pure extension. But you have to be careful with the overpressure and not use a lot of force. Then we can do passive side bending. For the passive side bending, I simply go to her iliac crest on my side. With my stabilizing hand, I take a little skin up and then compress down on her iliac crest. I grasp her rib cage as I did before, and now I'm going to side bend her towards her left side this way, avoiding me leaning over the patient. So I try and keep the shoulders over the hips, end feel, and overpressure to try and provoke the patient's symptoms. And I can do the same thing to the other side. Here, stabilize. I have to bring some skin up, reach underneath the rib cage, take her into side bending, and slight overpressure if I'm not able to provoke her with the side bending motion. We avoid passive flexion. We don't want to create a risk to the disc. So now we can go to our passive 3D tests. For our passive 3D tests, we're going to first start out with 3D extension, side bending, and rotation. When you perform the passive tests, a rule of thumb is to always rotate the patient away from you. So in order to stabilize the patient, I'm going to use the same stabilizing arm behind the patient, but this time, instead of being over the sacrum, I'm going to be over the opposite PSIS. I'll place, in this case, my left foot forward. I'll grasp the patient under the rib cage and stabilize on her right PSIS. Again, avoiding any side bending as I get into this position. Now I'm going to first extend her as we did before, allowing her hips to rotate and the pelvis to rotate forward. And now I take her into extension. Then I can drop her into lumbar side bending towards me and then rotate away here and add a little bit of overpressure if not provoking her already with the passive test. It's important with this test that this hand does not move, this arm. We want to make sure we maintain stability on this side, so when we extend her, if we don't add the stability and we move on this side, she ends up rotating. So this hand stays still, this arm moves, we bring her into extension, side bending, rotating, and I am now dissociating my left side from my right, moving the left side and stabilizing the right. Good. Now, while I'm here, I'm going to perform an extension as we did before. This time, right side bending without leaning over the patient and right rotation. Good. I'll change sides. Now again, so I can rotate, always rotate away from me, rotate her spine away, stabilize on her left PSIS, grasp her rib cage here just under her axilla and under her scapula. I'm going to take her into extension first, side bend towards me, rotate away, and then finally extend the patient, side bend her away without leaning onto her, and rotate away here. These are subtle movements. If you see the patient moving a great deal, you've probably gone too far. Now let's finish with passive 3D testing in flexion. For this test, I'm going to now always rotate the patient towards me. I'm going to first reach around and stabilize on the contralateral ASIS. I'm going to reach through her arms to her shoulder. I'm now going to flex her down, maintaining a vertical sacrum. I'm going to first side bend her towards me and then follow it with a rotation towards me here. Next, I'm going to flex her down. I'm going to side bend her away from me and once again rotate her towards me. I can give her a little bit of overpressure at the end if I can't provoke her already with the flexion test. I'll switch sides. Once again, stabilize the contralateral ASIS, reach through her arms to her shoulder. Now I'm going to flex her down. Once again, maintaining a vertical sacrum. It's not flexing at the hips, but just in the lumbar spine. Side bend her towards me, rotate towards me. A little bit of overpressure at the end. And finally, I'll ask her to flex down, side bend her away from me, and rotate her towards me.